New social history, HPC or Health Point Clinic, teen, adult, 12 years and up. Updated and hopefully improved. The best way to learn is just to do it. You may not fully understand what is covered in this presentation if you're not currently using the new social history. Test patients have been loaded into ECW under ZZZ Hood for appointments on January 14th. Just for information, ZZZ Hood is listed right under Ms. Yarborough. Take some time this week trying out this new section in these test patients. The new Health Point social history has two sections. The first part is for all patients. The second part has additional questions for patients who are 18 and over, patients of any age being seen for OB services, family planning, or Healthy Texas Women's Services. All but two of these sections show the date it was completed or the last time it was updated or reviewed. The two sections that do not list dates are the alcohol screen and the tobacco use screen. These two are linked to a timed adult CDSS alert. The DES screening question is being moved from the sexual history section of the social history to the GYN history in the HPI section. In case you wanted to know what DES is, it was a medication used to prevent miscarriage in pregnant women and used between 1940 up until 1970. It was discovered that daughters born to women who took DES when pregnant had increased risk of developing cervical and or vaginal cancer. It is recommended that women who were exposed to DES in the womb should have a yearly pap smear and pelvic exams. How do you pronounce the full chemical name for DES? It is diethylstilbestrol, just in case you wanted to know. We are reducing the abuse screen in the social history. For adults, we will rely on the Prepare form to screen for current domestic partner abuse. For PD, the Prepare form will also screen for current domestic partner abuse, and the screening questions from the social history will be added to the Well Child Checkup template for patients 12 and up. This is to screen for past abuse. If needed, there is a template to pull the abuse screening questions into any progress note. We will have a separate screening tool for alcohol and drug abuse for patients 12 to 18. This is called the Craft Smart Form. This form will be built into the Well Child Checkup template for patients 12 and up. More information on this on a separate handout. One new question that has been added to the Health Point social history is screening for communication needs. These are needs other than language. Listed on the right are the drop-down options for this question. There's a similar question that is in the current physical template, but will be removed from that template when we start using the new social history. When we did training for ECW version 11 update, you should have gotten a copy of the social determinants or Prepare Smart form. This form will be in the All section of the Health Point social history. When you click into the section, the Smart form will open automatically. Please make sure that you enter the date or update the date at the top of the form. ECW does not add or update this automatically. For questions about anxiety, it will prompt you to do the GAD-7 anxiety screen if the patient scores high on the section. Use of the GAD-7 is up to the provider. It is not a required screening tool. Check with your provider as to if they want you to use this form. The last question in the form is about enabling services. Don't check yes. If you do, you'll get a list of options that we're not ready to use at this time. When you click into the tobacco section of the social history, the tobacco smart form will open. For the question, are you a, you must select one of the first four options for this form to work correctly. Clicking on light smoker and or heavy smoker will not trigger the additional needed questions. For additional findings, tobacco user, it is to screen for smokeless tobacco, pipe, and cigar use. Additional findings, non-user, these questions are nice to complete but not required. At this time, there's not a place to record e-cigarettes or vaping. The alcohol smart form will now open automatically when you click into the section of the Health Point social history. It will populate with data from the last time the section was answered. If a question was left blank, the points and interpretation sections will be blank also. Make sure that the points and interpretation sections are not blank before saving. The will-child template for 10 to 20 will split into new templates. Add these to your favorites. What's the difference? The 12 to 20 template has 3 additional sections that we'll start doing at 12. And that is the PHQ-9, the Craft Smart Farm, and abuse screening. The original 10 to 20 will-child checkup will still be available, but if your patient is 11, you'll have to move the sections that we don't start doing until 12. Points to remember. On Monday, January 14th, you can start using the new Health Point Social History. It is not expected that you'll get a new complete social history on each and every patient that day. Try doing a section or 2 at each AC, revisit, or follow-up appointment. Try to complete the new social history for new patients and at physical will-child checkup appointments. Do not use the old BBC social history, and don't pull it into the current progress notes. Once you have completed the new social history for a patient, you can delete the old BBCA social history. It may take some time to get patients converted to the new social history. Just start working at it one section at a time. And like a coworker once told me, how do you eat an elephant? Just one bite at a time.